So welcome everyone to Hawai'i Care Choices Healthcare Resource Talks. I'm Tish Fukushima. I'll be your moderator this morning, and presenting today will be Lonnie Weigert, Community Relations Manager. We also have two very special guests joining us today. But before I start, I wanted to say that today's Zoom meeting is being recorded so that you and others may access it in the future. Please have your camera and microphone turned off throughout the presentation to ensure your privacy. If you have any questions at any time, please use the chat box feature below. We are also including polls today. So it's a little newer feature in our presentation. It's very simple. There are no right or wrong answers, and here's how it works. A question will pop up on your screen. Please make the best selection you can and submit your polls. I'm going to kick off with an icebreaker so you all are feeling a little more comfortable. Okay. There is our icebreaker, should be up on the screen there. Now it's very challenging to pick one or the other, but just do your best. We have half of the attendees already voted. We're just waiting for a few more. I always am stuck in between two of these animals. It's a harder decision than I think. Okay, everyone has voted. I'm gonna go ahead and end the polling and share the results. So the icebreaker question was, if you could be any animal, which one would you be? A unicorn, a dolphin, or a monkey? So 38% said a unicorn, another 38% said dolphin, and 23% said monkey. So yay, thank you everyone for joining in on our icebreaker. That's gonna be how our polls will be working throughout our presentation. So very, very easy. Thank you everyone for participating. I would like to introduce our speakers for today. We have Lonnie Weigert, Community Relations Manager for Hawai'i Care Choices. Hi, Lonnie.
Hi, everyone. Aloha.
We also, speaking today, have Rachele Halliday, RN, and she is the Quality Director at Hilo Medical Center, where she monitors best practice to ensure excellent care. Rachele has worked in healthcare for 23 years and is a certified nurse manager. She is the bridge that connects Hilo Medical Center and Hawai'i Care Choices to be one community healthcare team. Thank you for joining, Rachele. Aloha.
Hi, good morning. Thanks for having me.
We are happy for you to join us. Our second guest speaker today is Councilwoman Lee Loy, District 3 Council Member for Hawaii County Council, Vice Chair on Planning, Governmental Relationships, and Economic Development. She is a community leader and a hospice advocate. Aloha, Sue. Thank you for joining us.
Aloha. Aloha, everyone.
Hi. Thank you for joining us again, taking time out of your busy day, both you and Rachele. Okay. So we will be moving on. For those of you that have just joined, I am Tish Fukushima. Welcome. This is Hawai'i Care Choices Healthcare Resource Talks. If at any time during the presentation you have any questions, please chat them into the box and I will be able to ask one of our guest speakers or ask Lonnie. Again, today's Zoom presentation is being recorded so that you and others may access it in the future. Please have your camera and microphone turned off through the presentation to ensure your privacy. If you have any questions at any time, again, there is the chat box feature below. Without further ado, here is Lonnie Weigert.
Aloha, everyone. Thank you so much, Tish, and welcome to our very special guest. Thank you so much for joining us, and it's such a pleasure to have everyone with us this morning, particularly during such uncertain times. I'm really glad that I'm able to share with you some resources that maybe for yourself, friends, or family may need coming up in the future, and we want you to know that we're here with you, particularly because of the pandemic now. A lot of people are not accessing their health care as they may normally do, which is why it was so important to have Rachele from Hilo Medical Center on our meeting today so she can share with you all of the things that's happening up at the hospital, and you can rest assured they're doing a lot to make sure everyone is feeling very safe. So let me just continue on with our programs. The three programs that I'm going to cover is going to be our palliative care program, our hospice care, and our bereavement care. And if for some reason you're unable to see the total screen, go ahead and minimize the talking part. And although you might not be able to see me, you could definitely hear me, and so you can see the screen. In any case, for palliative care, many of you probably have never even heard the word palliative, but it is a very, very important type of care that we provide now. To palliate means to ease, to alleviate, to soothe, and to reduce. And so a lot of times when people are dealing with serious illnesses, the symptoms that occur are very troublesome and cause quite a lot of discomfort. And so we're going to talk about palliative care as well as hospice care and then bereavement care as well. So we have an entire care continuum right here on the screen. Now, for most of you, palliative care is something that you might not have heard about. And so it's so important for me to just take a moment to explain to you what palliative care is. And patients who have serious or life-limiting illnesses would seek out palliative care. I'm going to tell you which illnesses that we are looking at as we continue. But what happens is, say if someone has cancer and they are taking treatments, there are oftentimes symptoms related to the treatments that they may take. Say if they're doing radiation or chemotherapy, they may have a lot of pain throughout their body or in certain areas. They may be dealing with a lot of stress or anxiety. And so palliative care is very, very instrumental in those types of illnesses and symptoms. And of course, palliative care was created specifically to boost and improve the quality of life for both patient and families. And so we're happy to bring this type of care to you. So anyone who has any of these illnesses would probably be appropriate for palliative care. The illnesses that we are focusing on in the program that we offer is cancer of any type, any stage, congestive heart failure, which is also known as CHF, COPD, advanced kidney disease. Patients can be of any age, so we also deal with children as well, and at any stage. And to continue to receive treatments like chemotherapy, radiation, dialysis, and surgery, you can keep doing that even on this program, where for hospice, most people are no longer doing any kind of treatments at all. And so this is one of the big different reasons people choose palliative at this time. Patients, of course, do not need to have a terminal diagnosis of 6 months or less. Great, perfect time. Brain teaser.
All right, so everyone, that poll should be up on your screen now. Wow, this one seems a lot easier to answer than the first one, Lonnie.
Great, excellent. Thank you. Let's move right along.
All right, I'm going to go ahead and share those results with all of you. So the question was, the goal of palliative care is to improve the quality of life for their patients and families. 100% of you says it is true.
Wonderful. We like to check, early, if everyone's had their coffee, etc., that people are actually getting the message. So I'm so proud of you, all of you. You just did so well. Yay. That was definitely the correct answer. Before I move on here, I'd like to ask Tish, is there any questions yet that have come in for Rachele, our guest from Hilo Medical Center?
Yes, there is. I would like to ask, Rachele, how is offering palliative care at the hospital helped patients, and how do people get qualified for palliative care? Great question.
Yes, offering patients the option of palliative care helps in several ways. First, it helps them manage their symptoms so they feel better. This also helps them stay out of the hospital and at home with their family and getting to do more of the things that they love to do. The palliative care program also helps patients to identify and design their own personal wishes for care and treatment now and in the future. So things like advanced health care directives can be completed. And this is an important tool for us at the hospital as well as for the patient and family so that everyone's wishes can be fulfilled when you might not be able to tell us.
Thank you so much, Rachele, for that.
Thank you, Rachele. That's excellent. So let me continue on. People will ask me oftentimes, when do I know that, my loved one needs palliative care? So these are physical signs that you actually could see. And if people are tending to go to the hospital and go to the emergency room a lot, or they often need to call their doctor. And when I say often, I'm talking about, it could be once or several times a week, visiting the emergency room maybe a few times a month. That is definitely considered frequent. So that would be a reason to take a look at palliative care. Also, difficulty in managing medications. As part of our services in palliative care, our team would come and actually help you or your loved one at home to manage those medications. Another one is the diminished activities of daily living. Now, what that means is, most people are having difficulty in managing their finances, looking into their checkbook. I mean, I'm actually really amazed when people do use their checkbook still. That's wonderful. I don't even need a palliative care, but that's a challenge. And then driving or going to the grocery store, preparing meals, doing light housework, you start to feel that you're unable to do that. And so those are definite signs that palliative care may be needed. And of course, always experiencing frequent pain, maybe there's fatigue and sleeplessness. It's hard to fall asleep in the night because of the discomfort, swelling in the legs and feet, and of course, nausea. So people will ask also, when should I sign up for palliative care? I'd say sign up at time of diagnosis. A lot of times people will not want to sign up at that point because they actually don't have any discomfort or symptoms that seem to be appearing. But my thought is that if you sign up for palliative care early, you can kind of get your feet into the pool and just sort of warm up to the idea of having a team assisting you with these upcoming symptoms that will be at your doorstep soon enough. And so it's important to get the information and particularly the education that your palliative care team can provide to you so that you have the heads up with regard to how you can manage the symptoms at this point. And also, the palliative care team stays with you throughout the course of the illness until maybe the illness starts to transition and maybe a higher level of care, such as hospice, may be necessary. So the medical issues could actually be addressed earlier, so many people can live with a lot more comfort. And as a result, will live with a higher level of quality for much longer. So what to expect when you sign up for palliative care? So before I move on to that, Tish, is there any other questions that have come in for Rachele?
Yes, I have a few of them, but
Okay,
I will ask one for now.
all
If
right.
patients qualify to receive palliative care, do they receive it while in the hospital or when they go home?
They actually, we screen all of our inpatient admissions for palliative care, and we use a scoring tool that's evidence-based, and it goes through all those chronic conditions like Lonnie just, and symptoms like Lonnie just went through. And if you qualify, most patients will start receiving palliative care when they're discharged home, but there are some instances for like symptom management or complex needs that we might start palliative care here in the hospital. It just depends on the patient's needs.
That is great. I have one more question if I can ask Rachele. Does offering palliative care help save the cost of healthcare in the long run? And if so, how?
It does equate to a lot of savings. Having a palliative care program aligned with the hospital, kind of how Hilo Medical Center and Hawai'i Care Choices are working together, we can decrease costs by about 30%, and that's done by reducing readmissions and emergency room visits, and those are about usually by 35% each. And then, of course, reducing the cost of the hospital stays also has a significant advantage.
Wonderful. Thank you, Rachele.
Thank you very much, Tish and Rachele. That's so exciting to get more information like that. So what happens when somebody signs up for palliative care and they are sent home after they're released from the hospital or their doctor's office? Our nurse will come to visit the patient at home, just like you see here in the picture. The nurse will evaluate the health and medical history of the patient. But what's really important here in palliative care is that we want to know the patient's biggest concern. And the reason is because we want to serve the patient in a holistic form, meaning it's not only the pain that we are addressing. We want to know what's important to the patient. For example, we will say, okay, is there anything in particular that's really weighing heavy on your mind? And a person may say, well, yes, I really want to go to my grandson's graduation at the end of the year. And I hope that you'll be able to help me. So immediately our plan of care will be placing all of these different goals that a patient shares with us, because when you have that kind of motivation, you tend to try a little harder to really make it. Or, you know, the patient may say, my family is going to go to Disney World for a family reunion and I'd like to be able to go. Or something more simple, say, I just want to get off the couch and walk to the mailbox in the front of my house without huffing and puffing and being completely breathless. Fine, we can do those too. And so it's really important for us to educate the patient and the family on what are ways that can help the patient manage their illness, whatever it is that they're dealing with. Now, medication review is such an important part of our palliative care program. And the reason is because many times when somebody is dealing with a serious illness, they go to more than one doctor. They go to their primary care physician, but they may also go to their cardiologist or some other ologist, or maybe they go to the emergency room. Maybe they go to urgent care one night, etc. But every time they go somewhere, somebody is prescribing them medication. And so like this picture that's here where there's just a mountain of medications, that actually is true when we go to people's homes, is they have so much medication. Some of it is expired, some belongs to their deceased ex-husband, others belongs to their adult children that no longer live in the home. And then there's about 36 medications that belong to them that they've gotten from all of these different visits that they've gone to. Now, what ends up happening is they tend to take everything that they're told to take. And sometimes the medications may counteract each other unbeknownst to them. So we find that when our team comes in, evaluates, and takes an inventory of all of the medication that's in the home, we find that by calling the primary care physician, who is in fact the lead on our team as well, he or she will tell us, okay, of the 36 medications, they should only be taking these 17. And I know that that's a lot of medication still. However, it's still better than 36. And so we find that once we get everybody aligned with their medication, they're able to at least see 5% of their discomfort from either nausea or swelling in the legs, etc., go away. So medication review is one of the top things that we do on our palliative care program. I'm not sure if it's frozen. Okay, great.
Lonnie, I actually have a few more questions for Rachele, if you don't mind.
Sure, you go right ahead.
Thank you, audience, for sending in these questions. Rachele, with COVID-19, what precautions has the hospital taken to keep patients and visitors safe?
That's a good one. And I will say that the hospital has placed many measures to ensure the safety of our patients, visitors, and our staff. When we say we are the safest place on the island, I really hope after I tell you all the things that we're doing that you would really feel that way too. Most obvious is that we all wear a mask. We adhere to good hand washing, and everyone gets screened for temperature before entering the building. Visitation is restricted to one person per patient. And then every inpatient admission has COVID testing and a COVID scoring prior to leaving the ER or being admitted to the unit. Every outpatient elective surgery has COVID testing prior to having surgery. Every employee was tested for COVID, and now we do random sampling. And we are testing any employees who travel before they come back to work. And any new employees, our travel nurses, our travel physicians that we hire are tested prior to starting work. Our HiloMedicalCenter.com page has up-to-date information about all the precautions that we're taking, our resources and supplies on hand for our personal protective equipment. And it also has resources for testing if you have any questions or want to get tested for COVID, that there's links to the CDC or Hawaii Department of Health there.
Great. Yes, there was a question on how people get the COVID test. When is it recommended and how much does it cost?
People can get a COVID test through their provider, sending an order into clinical labs. They could also go to any urgent care or our emergency room if they were concerned that they may have COVID symptoms or that they were in contact with someone who might have had COVID. There's still community-wide COVID testing through the Department of Health, and I believe it's the Premier Corporation that they do different spots throughout the island weekly or a couple times a week. The Hawaii Department of Health has a COVID page with great information on testing and testing sites. As far as restricting to based on symptoms and things like that, we haven't really been that restrictive here as a community or hospital. If you're concerned, we're concerned, and we'll go ahead and test you. Most COVID testing would be covered through insurance, or it's free if you go through that testing site. If you wanted antibody testing, that's optional and additional, so they do charge you, I think, $43 or $46.
Thank you so much, Rachele, for all of that information. The audience is very thankful for that.
Great.
Thank you so much, Rachele. Thank you again, Tish. Let's continue with palliative care. So the team also, in visiting the patient at home, will be doing pain and symptom management. They'll do care coordination, and what that means is care coordination is the patient will have to see so many different doctors, and sometimes it gets really crazy for the patient and the family to coordinate everything, and so our team is there to help them with that. We also, as I said, based on the goals of the patient, we will create a plan of care with the patient at the center of everything that we do. And also for our social worker who's part of the team, he or she will help the patient complete any insurance form. Say if they need Medicaid, we can go ahead and help them with that as well. So navigating through all of that sometimes is really confusing for a lot of people. So we're happy to be able to be there and help the family with that. And then of course, if a patient does not have an advanced care directive, we can go ahead and have that done while we are visiting with the patient. And then spiritual care if needed. And sometimes people will say, well, what is spiritual care? Spiritual care is something that occurs when we're talking to the patient about something that may be really bothering them. Something like, oh, I wish I told my dad I loved him before he passed, or oh, I wish my adult children would stop, complaining and fighting over the land, and just other things, or why is God doing this to me? Just different types of questions that come up, and sometimes they need to have peace and feel better about what is happening going forward. And so it's often really good when people need spiritual care that we can provide it for them. Now, portions of palliative care are paid for by private insurance, such as HMSA, United Healthcare, and also for those who have Medicare and Medicaid. So people will say, all right, well, I have Medicare, but that's all I have. There could be a co-payment when our nurse practitioner or our social worker comes to visit. And the co-payment would be anywhere between $20 to $40 if it's not covered by Medicaid. And sometimes people don't have Medicaid as well. So it's important to know that. And sometimes people get confused about it. So I needed to make sure I mentioned that. Now, I'm going to move on to a higher level of care. It's also under the palliative care umbrella. However, it's called hospice care. And hospice is really about treating the whole person, just very much the same as palliative care. However, once people move to a higher level of care, such as hospice, we often do so because people no longer want to keep seeking curative treatments. Now they just want to be at peace and be at home and enjoy their families and go down to the beach and have cookouts and just other things. They just really want to have a peaceful time in their life, and hospice care is definitely where somebody could do that. The philosophy of hospice care is different from palliative care, meaning for hospice, it's all about the quality of life, not necessarily the quantity of life. And that's why curative treatment is not something that people seek on hospice care. Really, hospice care was created to ease terminal suffering. So people don't realize, but oftentimes they'll say to us, oh, hospice, that means there's no hope. That means I'm just going to die now. Well, actually, hospice care was not created for the part of you're just coming to die. No, it's really about easing the suffering that someone may experience because of the serious illness that they may go through. And death is not an enemy many times. So, and for those of you who have watched your families go through really, really serious illness, sometimes it can be a blessing depending on what it is. the other thing too is death is not a requirement when people sign up for hospice care. It's really there not only to ease someone's stress, but it's also to give emotional comfort as well, besides physical comfort. And Tish, is there a question that has come in for Councilwoman Lee Loy?
Yes, there has. All right, let me just scroll back there. Councilwoman Lee Loy, can you share why you have been an advocate for hospice? And did you have any up close and personal experiences with hospice? Great question. Thank you, audience.
Yeah, thanks, Lonnie. Of course, this is very emotional for me. Hospice took care of my family when my dad was sick. I was just 26 years old at the time, and having to have very adult conversations about him, his quality of life, with my mom, who is a registered nurse, who understood a lot of the pain that he was going through. And as a nurse, she was really providing a level of care that she did every day. And so hospice really did help us kind of as a family provide the love and care that we needed for my dad, but also helped me kind of grow up at a time when, you know, you're 26 and you're living life, but to understand the very hard decisions that need to be made in a way that my dad knew we would be okay, but also helped us show up as our best selves at a time that we really needed each other the most. So thank you for that question. And ever since then, I've always stood by any program that supports hospice or healthcare choices. You know, now in my role at the council, we get asked to sit on nonprofit grant and aid, attend a lot of fundraisers, and it is so easy to give because I just know how much it helped us as a family when we didn't know how to help ourselves.
Thank you so much, Sue. Thank you. So let's move on. Thank you, Sue. That was so great for people to understand the depth of what hospice does for families. So hospice care is provided by a care team. As you can see on your screen here, there's an entire team that comes around the patient. And believe me, we don't all show up at the house at the same time, but the whole team is always looking out for the best care possible for any patient that we have under our program. So hospice supports patient and family. So a person who is suffering from terminal illness, people will ask me, oh, so how would I qualify? Well, if you do have a terminal illness and your doctor has given, your primary care provider has given his or her best guesstimate of 6 months to live, and many times people will live well past 6 months, and largely it's because of the intentioned care that they are receiving under hospice care. And again, patients who are no longer seeking any type of curative treatments, that is one of the big differences between palliative care and hospice care, as well as that there is a 6-month life expectancy as well.
All right, audience, here is our second round of poll parties. Go ahead and answer as best as you can. Oh, sorry for the extra bells. I'm not sure. I think, you know, it's just really helpful when we're, you know, I haven't had my coffee yet. Okay, we just have a few more people deciding, kind of going back and forth. Again, there is no wrong or right answer to these questions. Okay, I'm going to go ahead and end the polling. Thank you for participating, and I will go ahead and share your results. So the question was, hospice is where you go in your last days. 20% of you said that is true, and 80% of you said that is false. Lonnie, can you explain a little bit more about this, please?
Yes, thank you so much, Tish. Thank you, everyone, for participating in that. I just wanted to kind of get a temperature of how people were feeling about what hospice truly does. And so, yes, you would not contact hospice in the last days. In fact, for whatever reason, people would say, oh, no, don't call hospice yet. Mom looks like she's still doing good. So let's call right when mom is ready to pass. So this is a thing that is important for everyone to know. And maybe on the next slide, we're starting to cover that. Let me see so I can explain it more. All right, I'm waiting for that. Here we go. Okay, so what happens is when somebody is on hospice care and we get them on our care when there's only a few days left, it's only at that point to keep the patient comfortable, but there really isn't anything we can do to help the family. And that is really important. And let me give it to you this way. Like hospice is a type of care that really focuses on comfort. And it's not only the comfort for the patient, but it's also teaching the family resilience for the upcoming loss that is truly going to happen. And if they don't have time to strengthen that muscle of resilience, it is really, really a horrible experience for them when their loved one passes. So I liken hospice care as a level of service. So let's just say we're all on Heaven Airlines and our destination is clear. We're going to heaven. Some will go at 2 o'clock, some will go at 4, but make no mistake, we're all going to go. Anybody that is under hospice care, the patient and all of their family will go immediately to the first class cabin. And the reason is because that is where all of the comfort is. Now, anybody that for whatever reason they didn't know, nobody told them, they're afraid, etc., that didn't sign up for hospice care, they don't go into the coach class of the airplane. No, they don't. They go into the baggage compartment of the plane. And the reason they go there is because that is the roughest, longest, hardest, and coldest ride all the way to the end. And although their loved one will cross over the bridge to heaven, the family must take that flight all the way back. And by the time they get back, most of the family have just broken into a million pieces, and largely because they did not have the comfort care of hospice that could have been provided had they signed their loved one up early. So for all of you who did say that you call hospice in the final days is false, that is the correct answer. Call us as soon as the doctor says, yes, it looks like mom is terminal right now, and she looks like, best guesstimate, maybe 6 months. Call us then, because we have had people that have lived under hospice care for 7 years. 7 years. So can you imagine if you called to have mom come on in the last 3 days when she could have lived so much longer? I want you to get that message. It's very important. So again, when people think, oh, when do I know my loved one qualifies for hospice care? Well, if again they go to the hospital a lot, they go to the emergency room, or they have to see their doctor a lot, you notice that they're losing a lot of weight. They tend to be falling a lot, maybe going from the bed to the bathroom. And then you'll notice that their space of living starts to really shrink. Like maybe they were going from the bedroom to the garage and doing laundry. After a while, they can only make it to the kitchen, maybe then only to the living room, maybe then only to the bathroom, and finally just to their bed. You'll start to see these physical changes, as well as their appetite really diminishing. They're not eating or drinking much. They also have a difficult time sleeping in the night, and their skin, you'll start to notice their skin really thinning at places, and then of course having different types of infections as well. So hospice care is provided at home. That's the number one place that we provide it. 99% of the hospice care is provided at home. We can also provide it at a long-term care facility as well, but most of the people want to be cared for at home because that's comfortable. And especially with this COVID pandemic now, people want to be at home because they want to be around their families. And when they go into different facilities, we have to definitely restrict the number of visitors that come in to see them. So everybody really wants to be at home now. And of course, as part of the hospice care, all the medications connected to the diagnosis that the person was admitted to hospice is all included, as well as the medical equipment like hospital bed, etc. And the person may still keep their primary care physician if that's what they wish. So when we come to someone's home, we will create that plan of care again by the goals that a patient shares with us. Because again, our approach to the care for someone is really holistic. We want to know all the things that are affecting them, that are bringing them joy and bringing them pain as well. So it's very patient-centered. And then the plan determines how often we come to visit the patient, as well as all of the different things that help to manage the patient that the family can help with as well at home. Oh, time for the brain teaser.
Hey, all right. So here is another question for all of you. Very important one that we kind of all can answer truthfully. And these answers are anonymous. So thank you for joining in on those polls again. Lonnie, I feel like I'm, just back to school and loving these bells. It's actually really nice now. I hope all of you feel the same way.
I think when they hear the second bell, that's, hurry up, get back,
yeah,
finish.
Yeah. It's the reminder bell, and then you have the, like the tardy bell.
Yeah.
Where it's starting, the reminder, and then it's class is starting. Let's go. Oh, all right. So we just have 2 more people putting in their answers. Okay, thank you so much. I'll go ahead and share those results. So the question was, my culture expects me to take care of my family with healthcare needs at home. 18% said strongly agree, 59% is agreed, 12% is neutral, 6% disagree, and another 6% strongly disagree. Thank you again for participating in that.
Okay, let's move on to the next screen. Now, what was really interesting about that poll that we just took is that we found that a lot of times people would not call us to come and help them, largely because they were raised to believe that you must take care of your loved one on your own. But we want you to know that, yes, you can be a part of their care. However, you can ask for help. That's okay. It's actually important if you get that help, because it's one of those things where we're the experts, so we can come and help you. And that really eases you from a lot of the stress that you're dealing with if you're a caregiver. So do not, I repeat, do not hesitate. Please call us so that we can come in and help you. Now, here we show Hawai'i Malama Care Center. And sometimes when we have our patients at home, there may be times that their symptoms become uncontrollable. And so as a result, we need to bring them to Hawai'i Malama. And here is where we will try to stabilize and maintain or monitor the symptoms so that we can manage them and then allow them to go back home with their loved ones. Many times, though, when patients come here, they're actually towards the end of their life journey and they normally pass here. I'd say the average amount of time that people stay in Pohai Malamo is probably about 14 days. What's really important to know is that although hospice is covered 100% under Medicare, this is when someone has hospice care at home. If they need to come to a facility like this, then normally Medicaid would kick in for their room and board. And if people do not have Medicaid or some other type of insurance, normally we will accept private pay for them to stay at this facility for a short stay. So speaking of how hospice is cared for or is paid for is through Medicare. So Medicare pays 100% as well as most insurances. So Kaiser, Veterans Administration, Medicaid, and also any other mainland insurances, they normally will cover hospice care at home 100%. So again, I just want to remind you that if you don't have Medicaid, or if your loved one could qualify to get Medicaid, please go ahead and sign up for that, because Medicaid will cover room and board at any of the facilities. So what happens when our trained volunteers come and join the team? So our volunteers are really important with regard to our care team. Our hospice volunteers will come to the home and they will do all kinds of things to help the caregiver. And this is really important because a caregiver can get burned out really quickly and needs a rest. And this is where we found out that people don't feel comfortable with the idea that somebody else is coming in to care for their loved one. And that's when we started to tell people, no, you need a rest, because if you aren't getting a rest, you're not going to be a good caregiver. So kinds of things that the volunteers could do is they would sit and watch TV with your loved one. They could take them for a ride, to see the beach, or they could go to take them for a short trip to the store if they need to pick up something. But our volunteers are really there to boost the joy factor in the patient, and also to really give a much needed rest to the caregiver, even if it's just for a few hours during the week. It's important for the caregiver to know, as part of their team, we're there to support them as well. And bereavement care. So bereavement care continues 13 months after a loved one passes, a loved one that is on hospice care. And so this is part of us helping pull the family back together and all of the pieces that may have shattered during the loss of a loved one. And so we have different support groups that we offer to help people to really find ways of dealing with their grief. And we'll also be doing that for children who are dealing with grief as well. Basically, if children are old enough to love, they're old enough to grieve. And so we found that it's very important to provide these services out to our community as well. And this is our mission. So for those of you who may not know what area we cover from all the areas on the screen that are in color. So Lapahoehoe all the way to Ka'u South Point Road. And then the other areas are covered by the other two hospices on our island, such as North Hawaii Hospice as well as Kona Hospice. So I'd like to know, Tish, if you have any questions for any of our guests.
Sorry, I have to mute myself.
Yeah.
Yes, I do. I have another question for Rachele. When you talked about the hospital and the precautions that are taken due to COVID, a lot of the audience is asking if you could explain what happens when someone visits the hospital now and what the entry process is like.
Sure, no problem. So, as I said before, that everyone's screened before they come in. So you'll meet our screening staff at the entrance, and I think that you will find them like so enjoyable and happy. They're like every morning when they greet me, it just warms my heart. Anyways, they're so sweet. Sometimes there's a line, so if you do have an appointment here, be sure to come a few minutes early. The staff will screen you and ask you why you're here. If you have an appointment, they'll verify you on a list to make sure that you can come in. If you're visiting a patient upstairs that's an inpatient, or even if you're with someone and you're accompanying them to an appointment, we'll verify that there's only one visitor coming in with them. And if all that checks out and you have a mask on, your temperature will be taken. If your temperature's good, you can come on in. If your temperature's elevated, we'll recheck it. If you're the patient and you have a fever and you're being seen for that kind of condition, then of course you'll be able to go on in and you'll be wearing your mask and things like that. So, and we'll ask you to wash your hands or gel in before you pass go.
All right, thank you.
Thank you so much, Rachele. I just wanted to take a moment to say that we're very, very happy to have Rachele on our meeting today, because Hawai'i Care Choices and Hilo Medical Center, have really teamed up to provide the best care possible to our East Hawaii community. And we're so very, very grateful and privileged to have Rachele with us. And she's definitely one of the stars on the team. And we look forward to working with Hilo Medical Center quite a bit in the future.
Yes, thank you.
Okay.
Lonnie, for that too. I just want to also say, for those that joined a little bit later, Rachele is the quality director at Hilo Medical Center, and she has been a nurse for over 23 years. So thank you, Rachele, for that also. I'd like to also say that our second guest speaker is Councilwoman Lee Loy, District 3 Council Member. She is the Vice Chair on Planning on Hawaii County Council, Government Relations, Economic Development, and she is the Community Leader and Hospice Advocate for Hawai'i Care Choices as well. So thank you again and welcome, ladies.
Will you be sharing another question?
I do. I have some for Councilwoman Sue.
Oh, okay.
Excuse me, Councilwoman Sue, with COVID-19, many people are sheltering at home to be safe, which is affecting their access to health care. Do you have any upcoming plans to expand universal broadband across the island so that people can access both health care and education at home?
Oh, that's a wonderful question. Thank you for that question. With the CARES Act, Hawaii County saw $80 million. And there was a preliminary discussion already with the administration to go ahead and start looking at purchasing cell on wheels. That we call them COWs for short. And it's our hope that with this $80 million that we can purchase a number of these COWs and deploy them into our very rural communities, which is struggling with connectivity through internet or just digitally. That's one. And then more recently, in addition, well, with the $80 million, the administration was so kind to allow each council member an additional $100,000 in which they could infuse into and or collaborate to amplify things close to their community. And so just something me and my squad at District 3 has been thinking through is looking at providing digital equipment, whether it's computers or some type of device that we could use to deploy, partnering with other community partners like yourself, along with what is my hope is the fire department. The fire department has a program in which they'll go in and help our kupuna with smoke detectors. And so maybe using a multi-prong approach with our administration through the fire department, where they can check on our kupuna, install the fire smoke alarms, even do some preliminary health screening with blood pressure checks, helping and tapping into your organization where we could help get the training into our kupuna, because I know for some of them, just using some of these devices are challenging, and there will be a need for education. And walking in with a firefighter is always a good way to get in there. And then from a bigger perspective, using the CARES money to deploy these cows so that we can start to close the gap on that digital divide.
Oh, that's so awesome, Sue, that you brought that up, because we thought with the CARES Act that there was only PPE that, we could participate in. But if we could join in on your effort to get this out there, I mean, it sounds great to get those different digital monitors that you call cows out there. That would be wonderful, because right now the kupuna, as well as most people, are not coming in to get their regular health care or their access to regular health care. And so everybody wants to do telehealth. But with the digital divide, it really puts so many at a disadvantage. And I'm so glad to hear that, of course, you're ahead of the game. So I'm so very happy about that. Thank you so much for sharing that. Is there any other question for Sue?
There is, but before I ask Lonnie, we have an audience member that's asking about West Hawaii. Do they provide palliative care for the West Side?
Okay, at this time, Kona Hospice does not offer palliative care. They may do so in the future. They started to offer it a few years ago, but it was very difficult for them to sustain the program. And so they stopped offering it. But right now, only we offer palliative care here in East Hawaii. And that is probably the same across the state of Hawaii. The only other place that does palliative care would be at Queen's Hospital on the island of Oahu. So we're very grateful that we're able to provide this level of service to our community here in East Hawaii.
Thank you, Lonnie. Councilwoman, I do have another question for you, and it is, do you feel our local council members and legislatures have a good grasp on the value of hospice and palliative care within the context of many health and social services that are available?
Yeah, I actually, two champions that I know your squad could probably lean on one is Val Poindexter. She's very well versed with healthcare in rural areas. She also has $100,000, and she also covers the district that you guys represent or cover. And the other one is Miley David. She has sat on our nonprofit grant and aid for the entire 8 years or 6 years that she's been on the council, going into her fourth and final term. And so she's very well versed at the nonprofits that come through and seeing those that kind of help serve the most vulnerable in our community. And because she is from Ka'u, that is, an area which is the most rural that needs a lot of help. And so her intimacy with the nonprofit grant and aid will really begin to amplify and accelerate some of the conversations that we're having today.
That's perfect. Thank you so much, Sue, for sharing that. That's really important. Thank you.
Thank you. I have another one for Councilwoman as well. What kind of precautions has the county put in place with county services to keep people safe, yet still allow them to access services?
Yeah, that one's challenging. We've got some hiccups. Kind of everybody's learning something new. But what I can speak to is definitely our Office of Aging is keeping close tabs on our vulnerable population with our kupunas and the Meals on Wheels program. So we're trying to dovetail those things and those services better together. But I think separate and aside from what the county does, I think we have a number of wonderful community partners who are really engaging in those services. And one thing we're trying to do is really take a pulse on where that ask is coming from, so that as we move through the CARES money, not only just what the administration has and then what council members have, but taking our nonprofit grant and aid requests, which is always upwards of 175, and looking for synergies between those asks and closing the gap. So we do have an all hands on deck approach. All of our staff has become very intimate with the guardrails for the CARES money. And so if we can find a way to bridge, yeah, Lani, if there's a way we can find a way to bridge, the money with the people, but amplify touching them in multiple ways would be the best way that we fall forward through this pandemic and what will be more challenges ahead, but more importantly, the lessons learned through those challenges.
Yeah, that's important. That's really important. So everyone is just sort of making the best of it then, Sue, down at the county with regard to people coming in and getting permits, or, having to go, do whatever they normally do at the county. Are the offices open, or how are you guys doing that?
Yeah, the offices are open. I like to say they're on a skeleton crew. We have many who are working remotely, which are experiencing the digital divide themselves for the rural areas that they live in. But we really are trying our best. There is a number of departments that have kind of their own protocols as far as how to engage with them. And we're trying to get to a universal protocol so that when you want to engage parks, it's the same way as engaging Public Works or Office of Aging. But everybody's learning through all of this and really, really trying their best.
Okay, that's great. And I'm really happy to hear that you're already working on the universal broadband, especially with the CARES money. We were thinking that it would be a perfect fit, but we're looking for a champion, and as usual, you're right there in the front. So awesome. Tish, any more questions?
Yes, I do have a question for Rachele. Rachele, with the new inter-island travel quarantine going into effect tomorrow, does that affect any Hilo Medical Center services and response to COVID-19?
No, right now that should not affect anything that I know of. Yeah, when we had it before, it didn't affect our services. If you need to be emergency transported, you would be transported. It does, though, if you had to go to, say, Queens to be treated for something that we couldn't treat you for here, the effect would be that most likely, they have the same visitor policy as we do, and they may not allow visitors, so you may not be able, if you traveled inter-island, you wouldn't be able to go with your family member. That's the only thing I could think of. But as far as if you need emergency care, you can travel. And of course, if people have doctor's appointments and things, that was still happening when we were locked down previously for travel. Healthcare is still important and a priority, and more and more services are becoming and growing into the telehealth spectrum. And so we're building that here so people can either stay at home and receive their specialty care, or come here and we can be the connecting source between you and a specialty provider, you know, that might be someplace else.
Okay,
Thank you so much, Rachele. So Sue, I have a question for you. So congratulations, Sue, on winning in the primary. Yay! So I want to give you a moment for you to share with us, because now, you know, we can't come to any live debates, etc. But if you could just take a moment and share with us what your plan is for your upcoming term, you know, with the council, and what kind of great ideas do you have coming so we can be all excited about it?
Okay, yeah, you know, it's still a little early. We're looking at seeing another administration come in, so there's still more conversations to have. But because of COVID, I think as a collective, we're gonna have to really work hard together. We also have to look at ways to partner and collaborate. And one thing myself and and Ashley
Yeah.
is looking at is a budget that produces more outputs and outcomes, because we're not going to have as much money. And so we're going to have to really streamline those functions. That's one area I'm looking at. I know both Ashley and myself. Ashley she's always looking out for our keiki, and I tend to look out for our kupuna. So we'll definitely be looking at those things. And she has a wonderful relationship with Brian Schatz. And so hopefully we can start to funnel a lot more money down into our communities. I think from a long lens perspective, now is the time to really start aligning our policies better. I think over many years, they've been band-aided in, and now is a good time to make them work in real time. It's gonna take a heavy lift, and so I'm gonna need a lot of partners and community voices like you folks to really stand up alongside us. And that's why I think with some of the work that Ashley and I are doing, where we can kind of set those, not only the measurables, but also our policy goals, what we're all striving for together, and really set that as a clear focal point for all of us. You know, I just love my work. I love the work that I do. I love our community, and I really do believe that we are the big and best island.
Yeah, definitely. Can you give me a few examples on some of the policies that you and Councilwoman Ashley have worked on that, you know, would be relevant to us here on this presentation?
I think first and foremost, and I gotta thank all my other colleagues, we moved in an extra $1 million for that nonprofit grant and aid. We were only giving we were only giving 1.5, and there was always so much need and so much ask. And so introducing a bill to increase that to $2.5 million, I think really does help our nonprofits. I think the other thing that Ashley and I will be doing, besides the goal setting and level setting about how we expend our money, is touching on partners like yourself and even those with Vibrant Hawaii, and using the ALICE report as a way to constantly focus us and guide us on helping the most vulnerable. And then that's the one side, is really reaching into our nonprofits and our community partners. But the other side definitely is the county pushing hard on the core infrastructure, making sure that, you know, the broadband is there, those abilities are there, the connectivity is there. And we always talk about connectivity in all kinds of ways, right? Whether it's this way or just connecting our roads better, or making sure that our services are connected better. I think it's time that we really begin to refine and get efficient all around.
That's awesome. I have two questions that came in. One was, can you tell us what ALICE stands for? And another one was what DPW stands for.
So it's asset limited income restraint. It's families that fall in the gap and they just have very kind of break even margins when it comes to paychecks. And then DPW is our Department of Public Works.
So, you know, now there's a lot of people that are struggling with the unemployment, especially because the subsidy amount is sort of up in the air. Is there any plans in the county to help families with that as well?
Right now, the only thing I really am aware of is that $100,000 that each council member got. We hope to use that as a real shot in the arm. Our monies will kind of hit our account September, and we have to spend it pursuant to the CARES Act by December. So we're going to have to infuse this money real quickly. And so we're going to need everybody, all hands on deck, to just, you know, roll up their sleeves and work hard.
I'm super excited about that because I think, you know, using that money strategically, especially when there's a bunch of council people that come together, you know, I love to work with the group. And so I'll definitely be coming out to you folks because I think it's so exciting that we have this boost. And if we use it properly, we can really get it, you know, get our reach far. And I'm so excited about that. Thank you so much, Sue. I'm so excited about that.
The word for the next few months will definitely be amplify. We need to amplify our collaboration.
Oh, that's wonderful. That's wonderful. I'll definitely be in the circle there with you. So, Tish, do you have any more questions?
There are a few more questions.
Okay.
One for Rachele. And excuse me, Rachele, a audience member is asking, when my grandfather was at his end of life, he spent some time at Hilo Medical Center a while ago. We were not offered hospice as he passed at HMC Extended Care. They want to know, is Hilo Medical Center staff making referrals to hospice, or should that be the patient's primary care physician?
It could be either. When they are transferred over to the extended care facility, that would be up to the extended care facility and the primary care physician over there. But the process that we just implemented with the palliative care screening went live in July. So if it happened prior to that, there were patients falling through the cracks, and now I think that we are capturing a lot of patients and sending tons of referrals over to Hawai'i Care Choices, and then they are coming to see the patients here before they are discharged. And so hopefully that process will be improved, and someone like your father or grandfather won't be left behind in that way.
I did want to mention it was prior to July, so they are very happy to hear of the development.
Yeah.
I have one last question for Councilwoman. Do you feel that our East Hawaii community is culturally accepting of hospice? And if not, how can a hospice advocate spread the word?
Oh, that's a tough one. I think generally, yes. I think, you know, you had that post question earlier about culturally we need to take care of our kupuna. And that was at 77%. I did the math. And I really think it'll take small champions like myself to just have that intimate conversation. Like it's okay. It's okay to ask for help. It just, because that's culturally, no, we're supposed to take care of it. But if they hear it from somebody else who went through it, to say, no, it's okay to ask for help, I think we can start giving them permission to say it's okay to ask for help. And you're not doing anything wrong by your kupuna. You're actually providing more care for them.
Yeah, that's absolutely true. Sue, when my mom was in hospice, I remember her doctor saying, "Oh, you know what? Your mom can have hospice." And I said, "Oh, there's no way my mom's going to have hospice. I mean, she's just this stoic Hawaiian woman. She's not going to have that." So anyway, when I went to her and I said, "Mom, guess what? You can have hospice." She said, "Hospice? Oh, I don't need that. I'm going to live a long time. I don't need that hospice." And I said, "Oh, okay. So you're not about it then, Mom." She says, no, I don't need that. And I said, "Oh, okay. Well, I mean, I heard we can get free stuff." Oh, okay then. Well, what? So as soon as I changed it from a medical issue to a financial issue, she was more open to it. And it's because of how they were raised too, like whatever myths or things that they were told when they were growing up as well, that, you don't need hospice, for whatever weakness, or, maybe hospice equals death. It'll actually cause people to die sooner. I mean, just whatever weirdness was out there. But yeah, when we switched, then she realized that, oh my God, when Daddy died, how come he didn't have this? And I said, yeah, and it's because, only now we're starting to bridge that, right? And so these little talks that we do like this, it starts to permeate throughout the community, just like a pebble in the pond. We just got to start somewhere, make a little bit ripples, and make it happen. So very good. Thank you so much, Sue. Thank you as well, Rachele. That was awesome. And Tish, do we have anything to close now?
Yes.
Oh, I hear the bells. I hear the bells.
Yes, thank you again to our guest speakers. I am launching a survey. If everyone could please take a moment. The results will not be shared. However, it just helps us to create more and better presentations for everyone. And after the presentation, once you submit the presentation, once you submit the survey, go all the way to the bottom. There are 8 questions, so I apologize for all of that. But they're very helpful information for all of us in this survey. Please go to the end of all 8 questions and then click submit poll. If not, that little button may not work. And I see some are already finishing up with that. If you would also like to chat into the box any last comments or takeaways, any comments for our guest speakers or for Lonnie, please enter it in that chat box and I'll go ahead and relay that message. Again, thank you everyone for participating in the Hawai'i Care Choices Talk Story with Rachele and Councilwoman Lee Loy.
Thank you, everyone. Have a great week.
Thank you so much, Sue, for joining us, and Rachele as well. And good, see, I'll definitely call you folks back to be my guests again at another time. Thank you so much, so you can come and update us. Thank you.
Your audience is saying thank you to our guest speakers, and thank you, Sue, for sharing your heartfelt story.
Awesome. Awesome.
All right, well, that does conclude our presentation. Rachele or Sue, did you have any last words that you wanted to say before we leave?
I did. I think we're all narwhals because everybody wanted to be a dolphin or a unicorn. And so collectively, we are now narwhals.
I love
my
it.
biggest.
We're gonna save that for another one so we can share that. Oh, we got narwhals.
Yeah, we got narwhals.
That's awesome.
That's always my two animals that I want to be. And so, you know, now I just thank you for that. I've grouped it together and now I'm a narwhal.
Yeah, a narwhal. That's awesome. What
Yes.
about you, Rachele? Anything?
Nothing extra. Thank you so much for having me. I really enjoyed it.
Awesome. Awesome, Rachele. I'm glad you got the word out. Now people know. Don't be afraid. Come to the hospital.
Yes, we're happy to help. We're here. That's what we're here for. Don't wait too long because then you'll be too sick.
Yeah, that's right. That's right. Thank you, Rachele. And Sue, we're going to be so excited with the changes upcoming, and we're going to be watching as you go along, girl. Go for it. Yay.
Thanks, everyone.
All right.
Another comment
Aloha.
from our, Lonnie, we have another comment from our audience that just said they learned more in depth about Hawai'i Care Choices and what they provide for our community. So mahalo.
Awesome. Awesome. Yay. Thank you. Thank you, everyone. Aloha and have a great week. Aloha.
Thank you for joining. Bye-bye.